before I dive into my own experience, I want to share exactly what TMJ is, because a lot of people hear the term and don't actually know what it means. TMJ stands for the temporal mandibular joint. It's the hinge that connects your skull to the lower part of your jaw, and you've got that on either side here. This is the joint that allows you to talk, chew, yawn, anything where you're moving the mouth. So when people say that they have TMJ, what they're really saying is that they have TMJ dysfunction or disorder, which is usually categorized by pain around the jawbone here, or it can be clicking, popping, or a feeling of tightness and struggling to properly open the mouth. Often this results in an achy jaw, tension, headaches. Sometimes it can be felt as tension around about the shoulders and the neck. There's many reasons why this can happen. Often it happens because the joint itself isn't actually tracking properly. Also, it can be caused by clenching of the teeth, grinding of the teeth at night, or even misalignment of the jaw itself and the teeth. Over time, that stress irritates the joint and the soft tissue around that joint. So that's a quick background of TMJ. I just wanted to get into that before I delve into my own experience. For me, I started to experience TMJ pain when I had suffered a broken jaw around 10, 12 years ago. After I had jaw surgery, I started to experience clicking on the left side of the joint here, and I was starting to really struggle to open my mouth properly without any pain. Chewing, even yawning was a real struggle. And once you become aware of these things, it's really, really hard to take your mind off it. And it was just constant every single day. For the minute I woke up, I would be thinking about like my jaw, how sore it was. Basically until I went to sleep at night, it was just unbearable, really, to be honest with you. So naturally, I started to try various different things in order to bring around pain relief. I went to my dentist at first, which, to be honest, I never really got much advice or help through that avenue. So I started to just explore things like massage techniques. These were good, they offered temporary relief, so I would do some kind of active and passive mobilization of the joint, and I would massage the masseter muscle here as well, which becomes really, really tense and stiff when people have TMJ disorder. However, nothing really worked long term, and it required a lot of effort daily just to keep kind of moderate pain relief at best. So last year I came across a dentist that specialised in TMJ, airway stabilisation, and it's like kind of holistic dentist, and they were talking a lot about things like TMJ disorder. So I decided to book an appointment with them. They're called Wonder of Wellness. They're based in Huddersfield in England. So I booked the appointment with them, headed down, and that was a game changer. They really explained to me, like, in detail why I was experiencing TMJ. Of course, I knew it was something to do with the previous jaw surgery. However, they went into more detail of things that I could do to alleviate that, and they came up with a kind of long-term plan as to how I could potentially fix my jaw, essentially change the shape of it through using some appliances, and also in the long term potentially getting some sort of jaw expansion surgery. So the main thing that I done initially without having any surgery was, so before I go any further, just to make this clear, this isn't medical advice, this is just my experience of what I have done in order to drastically reduce the pain associated with TMJ disorder. So that being said, the dentist recommended that I purchase their airway stabilisation course. I actually haven't done that yet, but they told me a little bit about what was involved in that. And during being on that course, somebody would use a device or an appliance called a Myobrace. So I went away and I done a little bit of research on what the Myobrace actually is. And I started to look into some YouTube videos, Reddit forums, these kind of things to see what other people's experiences were. What I was finding was that people were getting really, really good results in reduction of TMJ disorder and also kind of realignment of their bite. And by that I mean if the top teeth, sorry, are sitting a little bit over the front jaw, which I have got myself. So this here is what a Myobrace looks like. I've got 3 here because you need to. I've got 3 Myobraces here because there's 3 stages. You've got the first treatment stage, and second and a third. So just to be clear, this is actually a knockoff version of the Myobrace. So the Myobrace was a little bit expensive. I think it was around about £60 for each appliance, and you need to buy 3 appliances. So I went on to AliExpress and to see if I could find something similar for cheaper, just to see if it worked initially first and see if I got any benefits. So this is it's not the official version. I got that off AliExpress. So this is what it looks like. And just to be clear, it's not a gum shield. I've used gum shields in the past. They work differently. This is more like a brace, as you can see there. So the top teeth would go into this part, and then the bottom teeth would go into that part. As you can see, if somebody's got an overbite or an underbite, this is essentially going to align the top jaw and the bottom jaw and bring this TMJ back into the correct position so that the joint can actually slide and glide and track properly. I'm just going to put it in. You can see, like, I've got a really bad overbite, so I'm going to pop this in. So as you can see, it's pulling my lower jaw, the bottom jaw, forward so that it's in line with the top jaw. Now once you've got the appliance in, it's actually physically impossible for the 2 back teeth to touch one another. So even if you were to bite down as hard as you can, you won't be able to clench or grind those teeth. So what's happening when we're in that position with a Myobrace in, this masseter muscle isn't really fully able to contract. And when you've got this appliance in and you're susceptible to be clenching, grinding teeth, it stops that from happening. And over time, the masseter muscle it knows how to relax. And this is going to alleviate some of the pain and tension in this jaw area. However, what I must say is that when I first started using this little appliance, it was really, really uncomfortable. It actually says on the back that you should use it for several minutes a day. So it says here, directions for use. The wearing time should be short at first use. Just several minutes every time, such as 2 minutes, 5 minutes, 10 minutes, then half an hour for teeth adapting. So yeah, initially I just used it for 2 minutes, a few times a day, and it did actually make my jaw a little bit sore initially. build up a saliva in the mouth as well, which was pretty strange. But I just stuck with it, kept with it, started to increase it weekly, and I never really had a concrete plan. I just went with how I felt, and then I would say after about a month I was able to use it at night time. So if you do decide to get this device, just be aware that initially there's going to be an adaptation period and it's going to feel quite uncomfortable. But if you stick with it and you just keep using it consistently, eventually you will be able to use the first stage device overnight. That's another thing as well I should mention. If you've got like an overbite or an underbite, the transition might be a little rougher. But if you're watching this and your bite's fine and the only thing you're really struggling with is clenching your teeth, the likelihood is that you'll adapt to this much quicker than compared to somebody like myself. So then you go into the second stage device, which you're supposed to use for 2 to 3 months. Again, that's just a little bit firmer than the first one, but as you can see, it's still relatively pliable. To be honest, I didn't really notice much difference between this one and the first stage one. So again, there wasn't much adaptation to that. So I've now been using these for probably about 4 months or so. And yeah, I sleep with it in, and every morning I wake up, there's like zero jaw pain, nothing at all. Also, it allows me to breathe through my nose during the night as well, which just makes for a much better sleep. However, recently I've moved on to the third stage, which I must admit is actually like quite challenging. So I'm going to show you this. You can see like it's a lot stiffer than the other ones, and I can actually feel that when I wear this one, it's moving the teeth ever so slightly. So my bottom teeth kind of tilt in a little bit. So ideally they were to be out ever so slightly, and that will also help my bite. And it brings the front teeth in a little bit as well. So it's kind of pushing the bottom ones out and the top ones in, just to kind of get what they call an occlusion bite, which is a better bite than what I've currently got. So as you can see again, same as the ones before. And this one's really difficult actually. As you can see, I actually need to pull this one out with a bit of force in order to get it out. An important point with using these devices is this little bit here. You see this little flap? So that little flap there is where the tip of your tongue should be resting just at the top of that. And that sits just at the top of your two front teeth. And the reason that is there is because that's the correct tongue posture. Your tongue resting position should be at the top of your mouth, at the palate, at the roof of your mouth. So I'm going to show you with my mouth closed how that looks. Up at the top. So I'll show you a little picture, a little diagram, how that actually looks. So as you can see, the tongue is placed firmly at the roof of the mouth. And when we place the tongue firmly at the roof of the mouth, what happens is that also allows us to relieve a little of the tension in the masseter muscle. So ideally, tongue at the roof of the mouth, and then you have a slight gap between the top and the bottom teeth. So and that's going to help just relieve some of that tension on the masseter muscle, which then relieves more tension on the jaw. So the main things that I've noticed since I've used this little device is much less clicking on this side of the jaw. fairly noticeable now. I really have to move it about in order for it to click. I don't grind my teeth anymore. I don't clench my teeth during the night. As far as I'm aware, I don't mouth breathe or snore during the night, and I'm always waking up feeling well rested. And as I say, when I'm eating, chewing, yawning, I don't have any pain whatsoever in this jaw. Sometimes it might feel a little bit tight, the masseter muscle, but generally I would say it's about 95% improvement for where we were at before. That's why I wanted to make this video, because I know how infuriating, frustrating TMJ disorder can be, and I just hope that maybe this video will be able to help somebody with TMJ disorder. So that's my journey with TMJ and the Myobrace. I hope this video's helped. I just want to reiterate that this is not medical advice. If you need medical advice or you need advice from a professional, I would recommend you go and see your dentist or a orthodontist. If you've enjoyed this video or found it useful, please like the video and subscribe to the YouTube channel. And if you've got any comments, please leave them below. Any feedback, if there's any other topics you would like to discuss in the future, then please just send me a message. I hope this helps.